So we now have time for maybe one or two questions. A question I have is about the 500 Cities initiative. Is it too late to get vision included now?
Well, I mean, my understanding of it is it's kind of an ongoing initiative. We are working, and Brian and I and others have been talking about this, working on a sign-on letter from across the vision community to send a message, especially as a new head of the Robert Wood Johnson Foundation comes in and a new head of the CDC, to send a strong, coordinated message from the vision community that eye health matters and should be included. So we're hoping to start that process, and I think there are opportunities because it's a web-based initiative, and they'll be updating it, and I'd love to see this CDC National Surveillance System effort integrated as a part of that 500 Cities piece. Probably won't happen overnight, but I think it's something that we can work toward.
Okay, thank you. Brian?
And I would just add that the new president of the Robert Wood Johnson Foundation is Richard Besser, who is currently the chief health correspondent at ABC News, but before that was the acting director of the Centers for Disease Control and was at CDC for many years. So I think we would be perfectly positioned to get his attention. Many people would be trying to get his attention, but I think he would see the logic behind this and the wisdom. Also, I would just say that I think part of our task in sort of collective action is also bringing in sort of partners that have not previously been involved in vision issues, and this might include not only the Robert Wood Johnson Foundation, but some other large foundations that have public health efforts. And working together in partnership, we may be able to accomplish some things. So I'm hopeful.
That's great. Dr. Higginbotham?
Yes, Eve Higginbotham, University of Pennsylvania, member of the committee. And my question's for Mr. Jarkowski. Given that it appears that the thrust for healthcare is going to be at the state level with block grants for vulnerable communities, at least that's what is on the horizon. Do you anticipate broadening your efforts to help us at the state level because it's the vulnerable communities that we're most concerned about? And a second question, very quickly, is there an opportunity to get additional funding for perhaps some T4 funding to be able to expand our portfolio at the National Eye Institute so that we can actually get some of this research done? Thank you.
Dr. Higginbotham, I'm not an expert on state advocacy, but obviously I do coordinate with Jeff, and they have many state affiliates. So obviously, I think we have to be creative moving forward and looking what opportunities there are out there. Of course, I have a board of directors that takes a look at what our mission is, and of course, we do coordinate with many of our member organizations that do have state chapters and state affiliates, et cetera. But I think everything's on the table for the future.
If I can add to that too, and thank you for all your work on the report, by the way. This is something we're considering very significantly, and I'll use one specific example. In the essential health benefits, currently a children's eye exam and screening is available as an essential health benefit. It's very likely that that's going to go away, and so then it's going to be incumbent upon the states to work to ensure that vision still play a role in children's eye health, and potentially we can engage an essential benefit around adult health. The challenge certainly is you're going to have, not try to get not too political here, but you're going to have an administration that's saying, okay, this is the state's responsibility, and yet they're going to be likely pulling back on funding going to the states to fulfill that responsibility. So it's going to be a huge endeavor. But we're certainly going to be looking at how we redirect some of our energies from the federal level to the state level, because it looks like that's where things are heading, at least for the short term.
I'd like to thank the panelists for their participation today. We're going to have to stop because of time. And I wanted to welcome Dr. Heather Whitson, a fellow committee member, and she's going to moderate the session on future directions for improving consumer and physician education and awareness about eye and vision health.